Termination of quorum, receiving.
Dr. John Novak. Michael Brown. Commissioner Robert Lucy.
Here.
Councilman Dare.
Here.
Dr. Danko.
Here.
Councilman Delgado. Tom Young.
Here.
We have a quorum.
Mr. Chair, before we can move forward, I would recommend, being the I hold meetings quite often in those chambers, I would say that anybody who's on Zoom, if you can all mute your mics unless you're speaking, that will help the chairman tremendously, and you will probably diminish a lot of the feedback.
We do not, Chair.
Mr. Chair, nobody in Zoom can hear you guys at all now.
Hello?
Okay, mine's on.
Now we got you. We can hear you fine. If you keep one microphone on, you'll probably be fine.
Okay, we'll try to move on with this. First item on the agenda is the election of the chair for the District Health Board. And do we have any nominations?
I'll second that.
Delgado has been nominated. Do we have a second?
I'll second that nomination.
Danko.
Oh, good, thank you. Got plenty of seconds. Okay, all in favor?
Aye.
Aye. Those opposed? Well, Councilman, you're here. I've got a few things as kind of a swan song I'd like to do. I want to definitely thank everybody for the honor of being a chair of this board. It's quite an honor. We've had a tremendous board with good balance, good representation. We've got a lot of people that have put a lot of time and effort into something that went from a monthly meeting to a pandemic, and boy, do we have a lot of learning curve going on. I want to especially thank all the staff of the whole health department for rising above and beyond anything that was imaginable, being very creative, being innovative, and mostly just sticking it out when sticking wasn't fun. So I want to thank them. I want to thank my previous leaders that helped me get into this role, and that's Kitty Chung and Julia Ratty, who were the chair and vice chairs ahead of me, taught me a lot. I want to give a special shout out to my board, and it's not my board, it's our board that has gotten us so far down the line. I want to thank the individuals for always giving me advice, opinions, guidance. Some of the opinions I'm not sure I always needed, but I got them anyway, so thank you anyway. Want to thank our health officer, Kevin Dick, for being an amazing person through all this. Always there, always solid, taking a lot of stones and arrows sometimes, but I want to congratulate him for doing a tremendous job in a very, very difficult time. And he always seems to hang in there. I want to thank County Manager Brown for being there when I needed advice and how do you do the system. He's always been there. And a special thanks to Chief Brown, who has been there basically almost every day we talk. We have talked, laughed, cried, been baffled to no end, but I want to thank him for his dedication, his always trustworthiness, and always to be there. So, for this, Councilman, it is now your meeting.
Thank you.
And we'd like to, this is Rika Danko, we'd like to thank you for all that you've done for us as well. So thank you so much.
Thank you, I appreciate it.
And,
Yeah, Oscar.
can you guys hear me?
I can. Can't hear you now, Oscar. But when you get a chance, I'd like to say something to John as well on this point.
Can you hear me?
Yes, we can hear you now.
All right, thank you. Dr. Danko, I believe that you're making some comments.
I was just thanking Dr. Novak for everything and echo in your comments. I feel very honored to be a part of this board, and thank you so much for all you've done for us, even before the pandemic, but certainly through the pandemic, and we're very fortunate. Thank you.
Thank you.
And of course, Councilman Dare.
Yeah, I want to say, you know, you stepped up. You stepped up even before the pandemic when you helped us get our credentials and it came to our licensing and things. I'll tell you what, getting accreditation is a huge thing, and you traveled and you went and you gave a lot of your own personal time. I tell you what, that's what giving to the community is about. Thank you, and I can imagine when you signed up for this, you did not think you were going to have to give or sacrifice as much as you did, and so thank you, and appreciate all you've done for the community. This is only a continued piece of other things you've been a part of. So you're valuable to Sparks, and want you to know that. And thank you.
Thank you.
Thank you, Councilman. Anyone else? Any words? See, none, and of course, maybe an opportunity later as well, but it's an honor for the board to elect me to take over as chair during this time. I appreciate everyone's support as we get through this as best we can, but of course, I have big shoes to fill. Thank you, Dr. Novak, for your leadership, for your humbleness, for your thoughtfulness, and I look forward to continuing to work with you, keeping you close, be calling you late at night,
You betcha.
and I appreciate a lot to learn, so thank you. With that being said, we'll give our thanks and share it a little bit more. We'll move on to item number 5, the election of the vice chair for the District Board of Health. Do I hear any nominations?
I have a nomination and with discussion. There's a lot of conversation going on, obviously with our concurrent meeting, we'll be talking about that. One of the things that we have talked about is the vice chair and chair potentially being elected officials. And there's reasons for different that, we can get to that, but I will nominate Bob Lucy as vice chair as he's coming in. I know he's newer on here, and so that's a question, but I do know that he's not new to this conversation. He's been quite involved, and so that's my nomination. Thank you.
Thank you, Councilman Dare. Chairman, may I have a second for discussion?
Yes, can I get a second for discussion?
I'll second that.
A second from Mike Brown for discussion. Please, Commissioner Lucy.
Thank you, Mr. Chair. I appreciate the opportunity. I know that I am new to this board in the role of a board member. However, I am now new to the health district. And as Councilman Dare pointed out during the concurrent meeting, there was discussion about the electeds both serving as the chair and vice chair. I don't know where I fall necessarily on that being a necessary issue. However, as the vice chair, I feel that it's a responsibility, as the chair is as well. They're responsibilities, not just titles. And I think that through this pandemic, I have done everything I possibly can to be intimately involved, not only with the health district from that standpoint, but also through the pandemic, through the entire state. I am looking forward to, if I have the opportunity to serve this board as a vice chair, I assure you I will continue to be dedicated to the role and work closely with the chairman and the entire board for the ultimate outcome of the public safety and health through this health district. Thank you, Mr. Chairman.
Thank you, Commissioner Lucy, for those words. Any other discussion on the election of the vice chair? Before we take the vote, I'd just like to thank Mike Brown for his leadership as a vice chair for all these years as well. Both of you were steadfast, again, thoughtful in the way we walked into the pandemic. still currently now, being as available and accessible as possible to Washoe County and to all its citizens. And look, thank you. Look at both of you in both of your eyes and appreciate all the hard work, sincerely. It means a lot to me.
And if I could, Chair, I want to say, echo of what Dr. Novak said. You have educated me to no end when it comes to the staff of this health district. And we really appreciate everything you've done for us as board members, but also what you're doing for our community. You're the worker, you're making it happen, so thank you very much. And Dr. Novak said a lot of pleasant and great things about everybody, and I just echo what he said, because this has been a great board to work with, work for. The board members, or the makeup has been outstanding, and thank you.
Thank you again for service. You guys aren't going anywhere, so we're looking forward to continuing the work. And congratulations, Commissioner Lucy. Look forward to working with you. With that being said, can I get a vote? All those in favor?
Aye.
All opposed? Congratulations, Commissioner. Let's talk soon, real soon.
Oscar, can I have one discussion point I just want to share?
Yes, please.
Mike, I want to tell you that, just in the same sense, I think what you bring to the table with your expertise, your background, and even your demeanor has been fantastic. So thank you, and I look forward to continue working with you. But thank you so much. I know that this has been an incredible time. Obviously, again, even for you, asking a lot more than I think anybody chose in the beginning thought they'd give. So thank you.
Mr. Chairman, if I can share one other comment as well.
Sure.
I know this is my first meeting on this board, but I have had the pleasure to serve with Dr. Novak and Mr. Brown as in your chairs. And you are, as this entire board, are been very fortunate to have the two of them as leaders through this pandemic, and for the last 2 years, they have done a phenomenal job. They've stayed resolute in their positions. They have been very steadfast in their decisions, in making sure that their first and foremost priority is this community. And I want to thank them for their service, their tireless service, the hours that they put in. They've done a tremendous job. This board has done a tremendous job against a number of odds. And I just want to thank you, all of you, for your service. I do appreciate all your time and effort. Thank you, Chairman.
Thank you, Commissioner. Any other comments? Seeing none, we'll close out item number 5. We'll go on to item number 6. Looks like we need to state the current bylaws in terms of the offices for chair and vice chair for possible action. Mr. Kevin Dick.
This is not an action item, Chair Delgado, but we wanted to, for the record, just communicate clearly that under the bylaws for the District Board of Health, the terms for the chair and the vice chair are identified in those bylaws as a 2-year term. So congratulations to both of you.
We have 2 years, Commissioner Lucy. We got 2 years. Look forward to putting in the hard work with you. Closing up item number 6. That was not for action. I had a different form here. We'll move on to item number 7, approval of the agenda. Can I get a motion, please?
I'll make a motion to approve the agenda.
Second.
A motion and a second. All those in favor say aye.
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 All opposed? Motion carries. Item number 8, recognitions. Mr. Kevin Dick, you take those?
Thank you, Chair Delgado. First, want to welcome Commissioner Bob Lucy to the District Board of Health. He was appointed by the county commissioners to serve as our elected appointee from Washoe County. So congratulations and welcome, Commissioner Lucy. Vice Chair Lucy, I don't know if you wanted to make any further remarks.
Commissioner, anything you'd like to say? All right. Oh, disconnected. Okay.
And then also wanted to recognize Councilman Christopher Dare as was reappointed as the Board of Health elected appointee from the city of Sparks. So congratulations to Councilman Dare.
Where's your gloves?
Thank you.
It's good to have you still on the board, Councilman.
Thank you. It's an honor to serve, and I can tell you, I just want to say to the staff and board, I tell you what, people understood all of the things that health gets to walk through and does. I think Bob Lucy has his phone on.
So,
Do I?
Yeah,
if you're not speaking, can you please put your, be on mute, please?
there you go.
Sorry, Chair. Sorry, Chair.
So I just want to say this, that people understood just all the different things that is so far reaching. I think it's been amazing and I'm still learning so much. So thank you. It's an honor to be here and look forward to helping our 2021 become what it is. So thank you.
Perfect. Thank you, Councilman.
All right. Ms. Valdez-Ben, is it possible to turn up the volume at all on the Zoom coming in? Okay. All right. Next, I wanted to recognize and thank former Commissioner Marcia Bergbigler, who has stepped down from the board as of the last meeting. So appreciate all of the service that Commissioner Bergbigler provided for us. And then also wanted to recognize myself, our past board chair, Dr. John Novak, and our past board vice chair, Mike Brown. I have spent many hours with these two gentlemen who just have been fantastic over the past year. Not what they signed up for at all, but they were all in our COVID response. And so just the amount of time that they have committed and that they have worked with me and supported myself and the health district's efforts in the response have just been incredible. It's helped keep me going. I'm very grateful to both of you. So thanks very much.
Congratulations to all. Thanks for serving. Thank you for your time. Appreciate it. Item B, please.
Thank you, Mr. Chair. Next, we have years of service, and wanted to recognize two employees from EHS that were both hired January 11th of 2016, so 5 years of service. So congratulations and thanks to Brianna Johnson and Ellen Messenger-Patton, who are both environmental health specialists in EHS. We have a new hire I'd like to recognize today is Benjamin McMullen, and he came on board on January 14th in air quality management as an air quality specialist trainee. So already hearing good things about him. Congratulations, Benjamin. Next, we have a retirement, and this is kind of a momentous retirement of Ms. Charlene Albee, our former division director for EHS. Who retired effective January 14th of 2021. And so that was after 25 years of service in the health district. And before that, Charlene was working in the air quality management program down at the Division of Environmental Protection. And so I moved to the state in 1991. And I began working with Charlene Albee very soon after that. So I have had a very long professional experience in working with Ms. Albee, and she has been just excellent and delightful throughout that. She's done a fantastic job in her career here at the health district. So I wanted to thank and congratulate Charlene on your retirement. And we have a small token of appreciation for you. I'm sure you're surprised that it's a clock. And it says, Washoe County Health District recognizes Charlene Albee for 25 plus years of dedicated service, July 31st, 1995 to January 14th, 2021. So thank you very much, Charlene. I don't know if you wanted to say anything.
Please. Speech.
Throughout all of it, I did the math, and as ridiculous as my second officer under. Through all the routine work, we also have this incredible team that's able to balance response to wildfires and floods and now pandemics. It really has just been a privilege to be part of it. Thank you all very much for the opportunity. Some challenges. And,
Congratulations, congratulations, Albie. All right. 25 years. Amazing. Thank you for your service. Thank you, thank you. Any other comments?
Yes, this is Christopher Dare.
Yep.
Want to know, are we able to call her? I don't know that people realize the void of information. She is a trooper. She has served in so many capacities and has done such a fantastic job. I mean, obviously, you know, you get to a place, and I'd say probably in the sense of earning a retirement, she has worked so hard. But I want to thank her for teaching us a lot of things about things we don't understand, you know, as we come on the board. And but I do know that she's an incredible resource. So thank you. Does that mean we can't call you? You didn't answer that question.
I do believe my phone number has been posted everywhere.
Oh, okay, good to know. We might need that.
But I have full faith and confidence in everybody on the staff here to carry on the fight. It's all about the healthy community, and we'll keep going on as we move into the new era.
Thank you. I believe there's, was that Mr. Young?
Yes, I just wanted to say that I think we should have a new award in the health department of those who wore the most hats, and Charlene is going to be the record holder there too, and doing a hell of a good job there too. And you know, I think the health department's really going to miss her, but I'm sure she'll be around. So thank you very much, Charlene. Good job.
Any other comments? Seeing none, thank you again. Mr. Dickoff, sir.
Thank you. Next, I'd like to move on to promotions, and I want to recognize Erin Dixon, who I have promoted to Division Director for Environmental Health Services. Erin has a proven track record of leadership and administrative management. Also with her fiscal experience, I think she's going to be a great addition to Environmental Health Services. So congratulations to Ms. Dixon, who was supervisor in CCHS. And then I'd like to also recognize transfer Julie Hunter, who has been serving as a senior air quality specialist in air quality management, will be moving to the EPHP program to serve as our new EMS coordinator. And Vicki Olson, who's in that position, her last day will be tomorrow, is leaving the health district to pursue her passion in nursing while we're responding to a pandemic. So with that, our next recognition is for Excellence in Food Safety, our Excellence in Food Safety Award, and I'd like to turn it over to our staff representative, Kat Olson, for this recognition.
Thank you, Kevin. Hello, Mr. Chairman and members of the board. For the record, my name is Kat Olson, and I'm an environmental health specialist trainee. I'm a member of the food safety team, and this year we launched a new program called the Excellence in Food Safety Awards. The Excellence in Food Safety Awards were created to recognize food facilities that go above and beyond to demonstrate a long-term commitment to food safety. The criteria that facilities must meet to receive this award are of the highest standard in our community, and for years, BJ's Nevada Barbecue Company has done an outstanding job to incorporate food safety in all operations. Not only has BJ's excelled in their routine inspections, but they have maintained a large and well-executed food safety plan, complete with equipment and food monitoring logs. BJ's also provides continuing education on food safety for all of their staff and has been a strong advocate for preventing the spread of COVID-19. BJ's Nevada's Barbecue Company will receive this award certificate along with a window cling and a digital logo that they can put on their website. Additionally, their facility will be denoted on the Washoe Eats app with a custom award symbol, and notice that they are the 2020 winner of the Excellence in Food Safety Awards. This program represents the best of food safety in Washoe County, and it is with great excitement that I present the very first Excellence in Food Safety Award to the man behind the hard work, Mr. Jay Rathman with BJ's Nevada Barbecue Company. Congratulations, Jay.
Awesome.
Thank you so much. Thank you all very, very so much. We were extremely excited to hear that we had won the award. And thank you very much for even taking the time to look at obviously what we were doing and selecting us for this. This is fantastic. Everybody at the restaurant was excited just to hear that we had won it. So I can't thank everybody enough for this award for the 2020. We're really stoked.
Well, it must have been very impressive. Congratulations. Please give our congratulations to all the staff there. I'm sure it takes a team. And we set the bar, so I'm sure all the other restaurants are watching and learning as well. So thank you for doing such a great job.
Thank you so much. And again, we've had a great 35-year run with the Washoe County Health District, and it's been a fantastic relationship.
Delicious food. So thank you.
Thank you.
Any other comments?
I've just won here too, and I want to congratulate you, Jay. It's a great honor and things there too. But I do think that this type of program that is giving positive reinforcement to restaurants who are doing it right is exactly the direction this health department has been going. And I think that we're going to see lots more improvements and lots more excitement in this regard of possibly, saying, "Hey, great job" to everybody else too. So good job, and I'm sure that. As this pandemic's over, we're going to get lots more people on this list too.
Absolutely.
Thank you, Tom.
Response time.
Yeah, I just want to say I eat there all the time, so I love hearing. It's healthy. I'm glad you're healthy and good. I love to eat there, and I just was there this week. Thank you.
Issues they outline in the delivery impact report.
Thank you, Councilman. And again, if you're not talking, if you could please put your phone on mute.
Labor disputes.
Any other comments? All right, thank you. Congratulations again, Jay. BJ's Nevada Barbecue.
All right, next we have another award, the Extra Mile Award. And this is for the Golden Silver Inn Restaurant, and I'd like to turn it over to our staff representatives, Claudia Garcia Aguilar and Kelly Goatley Seals.
Hi, good afternoon. Can you hear me?
Yes. Yes, we can.
All right, thank you very much. I attempted to get on Zoom and was not successful, so I am on the phone, and I won't be able to physically show you the award through the video, but I do want to tell you about it. The Washoe County Health Districts, and by the way, this is Kelly Goatley Seals with the Washoe County Health District's Chronic Disease Prevention Program. And we are here to recognize a local business for providing a smoke-free environment for customers and employees. I'd like to thank the District Board of Health for joining us in this recognition. The Extra Mile Award honors businesses that have gone above and beyond the requirements of the Nevada Clean Indoor Air Act, making the conscious decision to go smoke-free when the law does not require them to. And of note, the Nevada Clean Indoor Air Act, which creates smoke-free indoor work environments for both businesses, just celebrated its 14th year anniversary in December. And last legislative session, that law was updated to include e-cigarettes. So now everywhere where smoking is prohibited, use of e-cigarettes and vaping devices are now also prohibited. And another milestone to note is that this Emma Award has been given out since 2008. And this 2020 award marks the 30th Emma presented to a local business or organization. The business we are honoring today was identified by our community for exemplifying a growing movement towards increasing smoke-free public spaces, including a local initiative for comprehensive smoke-free workplaces called Smoke-Free Truckee Meadows. 85% of Washoe County residents do not smoke, and there's a growing demand for smoke-free environments. By recently implementing a smoke-free policy, the awardee now provides a smoke-free environment for thousands of visitors and dozens of employees. So today it is our honor to present the Gold and Silver Inn and Restaurant with the Extra Mile Award. And the Gold and Silver is a restaurant and gaming establishment located near the downtown area, and they reopened smoke-free after the COVID shutdown.
Wow.
The Gold and Silver has been a Reno landmark for over 60 years and is now the only gaming establishment currently offering 100% smoke-free gaming in Washoe County. According to Gold and Silver's leadership, the transition to smoke-free was made easier because of COVID mask requirements and supported the gaming establishment making that permanent switch to being smoke-free. Another factor reported by Gold and Silver leadership was the desire to create a smoke-free environment so the staff and visitors could enjoy the facility without exposure to secondhand smoke and without experiencing the smell and irritation of cigarette smoke. So unfortunately, the owner, Jeffrey Payne, could not attend the meeting today to accept the Extra Mile Award, but I have it here in my hands and we will be delivering it to him at the Gold and Silver. So on behalf of the Washoe County Health District, we'd like to thank the Gold and Silver Restaurant for providing a smoke-free environment for Washoe County residents, families, and visitors.
Thank you for that presentation. Please give our thanks to Mr. Payne and to all those at Gold and Silver in the restaurant. What a huge change. They're a staple in our community. I know of them and everyone knows of them, especially if you're a Nevada native. But to go to smoke-free, that's amazing. Please give our congratulations to them for stepping up and going that extra mile. I know it's going to mean a lot, not only to their consumers, but it means a lot to the community. So thank you for that.
Thank you.
All right, next, I'd like to recognize Diana Karlochek. She's with the Environmental Health Services Division. And for a number of years, she has taken the lead and organized the health district's Adopt a Family campaign for the holidays. And so she led that effort again this year. And through her efforts, we collected 106 hygiene items and cleaning supplies, 63 food items, $2,085 in cash donations, and we gave families a $100 Target gift card for each of the families that we provided this for, a $350 Winco gift card, and a total of 116 presents. So
Wow.
Just wanted to recognize her efforts and thank everybody at the Health District for their generosity in supporting families in our community over the holidays.
Thank you, District Officer. Thank you to all those that contributed. I'm sure it impacted those families and those kids and those families tremendously, especially during these hard times. It means that much more. So thank you for participating and thank you for giving back. Great, so seeing no other comments on recognitions, items number 8, we're going to move into item number 9, presentation, Washoe County District Board of Health Scholarship recipients.
I'd like to thank the chair and the board for inviting us to present on the School of Community Health Science and your scholarship endowment. Would it be helpful for me to share my screen so everyone can see our presentation?
Yes, please.
So we'll start by introducing your scholarship recipient, Rachel. There was a second student who benefited from this scholarship, but she was unable to attend today. We'll then provide an update on the endowment, and then Dr. Larson will provide an overview of some of the work the school has done and you've supported. So I'll turn this over to Rachel to introduce herself.
Hello, everyone. My name is Rachel Kaiser. I'm a second-year Master Public Health student in the School of Community Health Sciences, specializing in epidemiology. Currently, I'm working on my internship and capstone projects in preparation of graduation this May. And my capstone project is titled Factors Related to Healthcare Use Among Transgender and Gender Diverse Adults in Nevada. And my internship is actually with Dean Larson, as well as the Washoe County Health Department, to create an interdisciplinary team of students who can provide staffing supportive to the COVID-19 vaccine efforts. I would like to take a moment to let you know it's been an honor to be selected as one of the scholarship recipients of the District Board of Health, and I want to thank you all very much for your support and encouragement.
So the scholarship that you've set up several years ago has continued to perform very strongly. Unfortunately, due to some of the downturn last spring in the market value for June 20 for the last fiscal year is down a little bit, but we're anticipating that with recent growth that will continue to grow. So the estimated payout based on just this year's interest will be comparable to last year's award. So we're looking at between $824 and $916. So the scholarship should provide another award for the 2021-2022 scholarship season. Now I'll turn it over to Dr. Larson.
Members of the Washoe County Board of Health, it's a pleasure to thank you for your support of our students through this scholarship, and also for continuing partnerships with our school at the University of Nevada, Reno. You just heard from our development director, Jillian Suzak, and I'm the dean of the School of Community Health Sciences. I am not unfamiliar with the Board of Health or with the Washoe District Health Department, since I have been humbled to provide service as the medical director for the immunization program for almost 40 years. And it's been my pleasure, and I just really want to compliment the health department and the board for really staying the course and doing a brilliant job during this enormously difficult time. So I wanted to tell you a little bit about what we're doing at the School of Community Health Sciences. We just completed our self-study to become an accredited school of public health. All of our programs have been accredited by our national accrediting agency, all of our master's degrees, our doctoral degrees, our undergraduate degrees. But taking this next step to become a school of public health is really a big deal. It recognizes our school as really being rigorous and meeting all of the high standards that are required. This has been a goal of ours for 10 years, and we're very excited that we may see this happen in June of this year. That's been a big journey. We graduated our first PhD class last year, and we have a nice pipeline now of 14 PhD students who are moving forward with their academic work and really looking to make some differences in how we may approach our next pandemic. Our Master's of Kinesiology degree launched has launched this semester, and it's a growing field in our school. Kinesiology is very popular, very relevant to public health because of its emphasis on activity to maintain a healthy lifestyle. We have a growing school. It's grown 400% since I have been managing this school. And we're now over 2,300 students for both undergraduates and graduate program. That makes us a pretty big school on campus. We're thrilled because I think we're recognizing, particularly for our undergraduates, that they're committing to public health, and they see a future for them now that we don't actually have to tell people what public health is all about. They read about it in the papers every day. And so it's really provided an emphasis and sort of a passion for students who are coming to public health. Last year, we had over $20 million in research and contract activity. This has grown substantially over the years. Much of this is due to the work we do for the state, both at the Nevada Division of Public and Behavioral Health, the mental health and substance abuse, and with the district in terms of providing services, evaluation, assessments, surveillance, and then we also have a fair amount now of federally funded NIH grants that are coming in to, again, support learning about the issues having to do with public health and how we can do a better effort. So it's been very exciting to watch our faculty become more and more expert, and to really have that rewarded with, particularly with the federal funding, which is very, very difficult. Next slide. We've been very involved in the COVID-19 response. I think you know that. I sit on the governor's medical advisory team. You've been working with Gerald Dermott in the Nevada Public Health Training Center on training, managing, hiring, contact tracers, disease investigators, epidemiologists, biostatisticians. And so that's been very exciting. I'm thrilled to be working with Rachel to put together our volunteer core of students who are going to do the tasks. And it's been a pleasure to work with Lisa Lotritz on this, who is actually one of our alums. She got her MPH with us about 4 years ago. This year, we actually put together a Public Health Perspective, which was a COVID webinar series, entirely free, and it reached hundreds and hundreds of health providers and citizens throughout the state to help them understand more about COVID. We also support the Nevada CAN Senior Outreach Program, which is an outreach program to seniors who have been very isolated during this pandemic, and also participate with Delivery with Dignity for vets for especially our undergraduate students have been thrilled to be able to volunteer and be a part of that outreach. Our COVID crew, I hope you've seen some of their very exciting marketing work. They have focused on the Latinx community in particular to try to do outreach around information, around navigation, around providing the kind of information that makes sense to them, advocating for all of our mitigation strategies so that people can stay healthy, and now are going to be working on the vaccine information for communities that may not be as well connected to our more traditional health care. It's been a busy year for us as well, navigating teaching classes online for the first time for many of our faculty, and trying to keep our students engaged and active and feeling purposeful. It's been a challenge for all of us. And I want to really appreciate this scholarship because it does provide that piece of support that our students really desperately need. This has been a bad year for our students. And so this kind of support, this kind of help is always welcome. And with that, I'd like to complete my remarks, and I would be happy to answer any questions that you might have.
Any comments from the board? Any comments? Yes, Dr. Novak.
Dr. Larson, I do want to congratulate you on getting a fully accredited public health school. It benefits all of us here, and thank you so much for your personal involvement with the health district, but pushing all your students to get into public health in the first place. You've been invaluable to all of us this year. Thank you very much.
Thank you.
Any other comments from the board? I'd like to say thank you, Ms. Suzak and Dr. Larson, all for all the work that you do with all of our students. Congratulations, Rachel, and all the scholarship recipients. We look forward to working with you guys. We need you guys. So bring the innovation, bring the creativity, help us get healthier. We're all going to be successful once you guys are out here in the field with us. So congratulations again. District Officer Dick.
So next we have the consent item for possible approval. And so these are matters that may be considered for motion.
We're on item number 10, consent items. Does anybody from the board like to pull any items for discussion?
I move to approve the consent items, but I do want Kevin to know that his microphone can be barely heard.
Okay. So I have a motion. Can I get a second?
Second.
A motion and a second. Any public comment? I'm sorry. No public comment. All those in favor say aye.
Aye.
All opposed?
Aye.
Motion carries unanimously. Moving on to item number 11. Regional District Officer.
So, next is 11, the Regional Emergency Medical Services Authority, and review and acceptance of the REMSA operation report for December 2020. And I believe that Aaron Abbott will be presenting that today.
Good afternoon, Mr. Chairman and members of the board. For the record, Aaron Abbott, Executive Director for REMSA. You've all received a copy of our December compliance report for review, and I'm here and available to answer any questions you might have.
Looking at the board, any questions for Mr. Abbott? have a motion. Can I get a second?
Second.
All those in favor, aye?
Aye.
All opposed?
Aye.
Motion carries unanimously. Thank you, Mr. Abbott.
Next, we have the update on REMS's public relations for December 2020 with Ms. Jobson.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for REMSA, for the record. You have for your review the Public Relations Report for December, but today I'll offer some updates on some more recent activities. Throughout January, we were primarily focused on receiving and distributing the COVID-19 vaccine to REMSA's employees. We were able to inoculate half of our entire workforce within a week of receiving the vaccine. Now we are working our way through distributing the second dose. We are proud to say that approximately 90% of our employees voluntarily received the vaccine. We received a great deal of media interest on the vaccination efforts. All 3 local television stations covered our employee vaccinations. Dr. Jenny Wilson, one of REMSA's medical directors, provided an interview to KRNB earlier this month on how children can stay safe while sledding. And finally, Nevada Donor Network named REMSA's medical dispatchers and ground ambulance providers as first responders of the year. While not all life-saving efforts are successful, our medical dispatch and field provider team members understand that other lives can be positively impacted through tissue and ocular donation and are trained on how their emergency care can impact the donation process. You can learn more about the recognition at remsahealth.com news and updates, and I'm available to answer any questions you may have about our public relations report.
Thank you, Ms. Jacobson. Is there any questions? Okay, seeing none.
Thank you.
Thank you so much.
All right.
District Health Officer.
Chairman Delgado, our next item is presentation, discussion, and possible approval of REMS's request for a blanket exemption to response times retroactive to the month of July 2020 and lasting 90 days from the date of approval. I do want to note that we discovered earlier today that this did not have for possible action on it. So we've been advised that this is not an action item, and I think what I would recommend is we go ahead and have the presentation from Mr. Abbott today, and that we agendize this for approval at the next board meeting. With that, I'll turn it over to our staff representative, Vicki Olson, and Aaron Abbott. I'm not sure which order they're going in.
Before we do that, District Health Officer, any comments, or is that okay with the rest of the board members? Councilman Bear.
Is it wise? I mean, are we just listening, or are we allowed to discuss? Because that might help them when they bring it back. They at least kind of have an idea of the flavor, whether we're voting or not. Is that allowed?
I'm sure they could give their presentation. We can give them comments. We're not voting on anything. It's like a presentation, so I think it would help when they come back.
I like that idea better, because I think it would help them not waiting a month for us. Like, we're not going to say anything, right? Because I think there's a few questions that a lot of us know.
Thank you. With that, Mr. Abbott, the floor is all yours.
Thank you, Mr. Chair and members of the board. We did not have a visual representation or a report prepared for you. We did submit a EMS COVID-19 impact report for the board's review. We were not asked to provide a presentation on the topic. I'm certainly willing to go through the main aspects of the report for you if that is helpful, and then answer any questions that you may have. I do believe Andrea S. Also had possibly some direction regarding this item, and I would like to maybe have her comment and then provide me with what she would like in conjunction with the board.
Okay, we could do that. Andrea, if you're ready.
I think I'm actually, I spoke with Andrea previously regarding this item. This is Vicki. This is Vicki Olson, EMS coordinator, for the record.
Okay.
We just wanted to, the EMS oversight program did want to voice our support of REMS's request on this matter. And then I believe that, everyone had the report. I think we were just going to ask for if anybody had any questions for Aaron Abbott regarding this item.
Any general comments or questions for Mr. Abbott from the board? Councilman Dare.
Yeah, so for me, I understand, and I want to just make sure I think I understand. Can you make sure I understand the reason for this has mainly to do with hospitals when you come up and the work that's happening there, and then you guys are sitting and not being able to catch the next thing in the time. I mean, obviously we have this in place for a reason. It is, there are times we should look at it and make sure, and I don't think if that's what it's about. Can you answer that? And then I have a couple other thoughts on this.
Yeah, so great question, Councilman Adair. I think this issue is multifactorial. Hospital wait times are certainly an impact, as well as staff hours lost due to exposure and illness. We've had significant, actually over 18,000 staff hours lost since May 13th. So staffing has been a critical issue. Not only that, but medical provider fatigue. And we've also seen some pretty significant geographical demand changes in our system over the past few months that are difficult to adjust to on a dime. It typically takes us several weeks of data to start seeing changes in how the COVID-19 pandemic has changed our response area. And just as an example, typically people are concentrated in the core of our county, in the downtown areas of Reno and Sparks during business hours. People get on the freeway, travel in to the business centers, and then travel back home to the bedroom communities at night. And that's been something that we've been, we study and we look at on a fairly frequent basis, to make sure that we have our deployment or where our ambulances are actually placed for the best response. What we saw with COVID-19 is a lengthening in those responses due to people being home, people not coming into work. So not only did we have an increase in volume with flu-like illness, we've got a lengthening scene times with donning and doffing PPE. We've had, as mentioned, staff loss, hours lost with staffing. And then our wall times, as you mentioned, Mr. Dare, at the hospitals has increased dramatically. So it's difficult to get ambulances out of the hospitals. We have multiple times a day, we're asked to either wait with a patient on the hallway of the ER, waiting to offload the patient, or sometimes even wait in the back of our ambulance for hours at a time with a patient because the hospital doesn't have anywhere to put these folks. So it is a multifactorial issue. There are details about all of those issues in the report. And the request is respectfully made under the language of the approved exemption reasons for an emergency declaration. As everyone is aware, the governor made an emergency declaration, as well as the President of the United States under the Robert T. Stafford Act for the COVID-19 pandemic. And we feel strongly that the impacts of the COVID-19 pandemic have met the requirement of the exemption reason for the request.
Okay, thank you, and I appreciate. Thank you for the larger explanation. I would say I just in theory, because we're not voting on this, the 90-day, I understand that, and I like the idea of having some time on there, like I think I saw, and not just a blanket until we get out of this, because part of it is we really want to needle that thread and keep everything where it needs to be as much as possible. Because I'm a little concerned just at large of making sure that as we ramp out of this, that you guys are able to ramp out of this, because there might be a change of behavior where people are staying at home now, working even after this. So is this our new normal? And I'm not comfortable with making that. I think you understand my saying there. And then the other thing I think I would just consider is that we get a monthly report of really how these times are affecting you. So by the time, if the 90-day did come, we're able to, we're not just at the end ramping up going, oh no, we got to do this again or what's going on, but we can stay informed. And it's not just a thing like everyone's not concerned about it anymore. Those are my thoughts. Thank you.
Thank you, Councilman. Any other discussion, comments? Do we have any public comment?
We do not, Chair.
No public comment. Seeing this item is not an action item, we'll see it back here in front of us. Appreciate it. Thank you, Mr. Abbott. District Health
Thank
Officer.
you.
Thank you, Chairman Delgado. Our next item is presentation, discussion, and possible approval of the Regional Emergency Medical Services Authority Franchise Compliance Report and to find REMSA in compliance with the franchise agreement for the period of July 1st, 2019 through June 30th, 2020. And I'll turn it over to Vicki Olson.
Thank you, members of the board. This is Vicki Olson, EMS coordinator for the record. You do have my report. I have found REMSA to be in compliance with the franchise for this previous fiscal year, and I am available should you have any questions.
Any questions from the board regarding item 13 for Ms. Olson here? See none, any public comment?
No public comment, Chair.
Looking for a motion?
Make a motion to accept the report.
Second.
Have a motion.
Second, Rika.
Oh, thank you. That motion is second. All those in favor, aye?
Hey.
Aye.
All opposed? Motion carries. Thank you, Ms. Olson.
Thank
Item
you.
14.
Item 14 is the presentation on the COVID-19 vaccination process, and this was at the request of Councilman Dare. We have Lisa Lotritz and Jim English for this.
No.
Better? Okay.
Thank you.
Lisa Lotritz, I'm the Division Director for Community and Clinical Health Services, and with me, Jim English, the Regional Operations Chief and Health Branch Director for our COVID response. I just want to make a note, we have a correction to our PowerPoint presentation. We added photos and org charts and removed a flow chart that was still being finalized by the state. Next slide. Sorry, the clicker wasn't working. So. Okay. I'll go ahead and keep talking. So the COVID vaccine is a critical component to reduce COVID-19 related illnesses, hospitalizations, and deaths, and to help restore our societal function. And next slide. Okay, so the COVID, how it works, it's an mRNA vaccine, and it helps our bodies to develop immunity to the virus that causes COVID-19 without actually having to get the illness. It does require 2 shots, and I'll tell you about those. Next slide. There's 2 different types of vaccine. One is Pfizer and one is Moderna. The Pfizer vaccine is given 21 days apart. The 2 doses are 21 days apart, and it's for ages 16 and older. Moderna is 2 doses, 28 days apart, and that one is for ages 18 and older. Next slide. So our initial distribution approach, the Nevada State Immunization Program developed a prioritization approach, and it was based on CDC guidance, and it was very helpful since vaccine allocations are limited. Washoe County Health District developed a regional plan based on this approach, and Washoe County Health District is required to dispense vaccine based on the state plan. Next slide. Okay, so for initially, we followed the tier system. I know we still hear about tier 1, tier 2. So initially we were in tier 1, and we mostly completed tier 1 under that initial approach. And this included groups at most risk for direct exposure to the virus and those that are providing care for those infected with COVID-19. It also is our essential emergency services, and it includes the Federal Pharmacy Partnership Program, which is the long-term care facilities. The long-term care facilities could choose to opt in or opt out of the pharmacy partnership, and the majority of ours did opt in, and that is, it's the pharmacies that receive the contract are CVS and Walgreens. And so they're working with our long-term care facilities to provide vaccination to staff and residents. And there are a few facilities that were not eligible for the pharmacy partnership, and we are working with Safeway to provide vaccines to those agencies. Next slide. So the guidance was revised, and with recommendation from the CDC, and it was more tailored to Nevada's essential workforce. And this was implemented on January 11th. And we then did update our regional plan, and that was approved on January 22nd. Next slide. So just to talk about how, when we're making these decisions on which groups go when, these are the factors that, that the state considered, and that's in the playbook and are in our regional plan. So which populations have an unavoidable close contact with those that have COVID-19? Also, is the unavoidable contact sustained? Do they have to be with these groups for long periods of time? And then another factor, importance of job or special technical skills. Are these positions something that we can't easily replace? And are they vital for the overall community safety and well-being? And then along with that, individuals that are at higher risk for dying from COVID-19 or being infected, so mortality, morbidity, and then also immune response. Are they immunocompromised? So that's how it is tiered or it was prioritized. So great, next slide, in the revised playbook, instead of it being in tiers, it was put into prioritization lanes. So the left lane is our essential workforce, and from the top where we're talking about unavoidable contact, sustained contact, emergency services, down to our essential workforce that are providing the services that are so important for our community. And then on the right side is our general population, and starting with our community members that are over 70 and going down to over 65 and then immunocompromised. So we're working side by side with these two lanes. Washoe County Health District is focusing more on the left lane because we do have community partners that are working on the right lane. Renown has a pod that is serving 70 plus. Recently our pharmacies, and I believe Jim's gonna go into this more, we have 2 pharmacies that are working with 70 plus. But so we're focusing more on the left lane and letting our partners do more on the right lane. I'm gonna turn it over to Jim and he'll continue with our presentation.
Go ahead with the next slide. So Jim English, just for the record, I'm the Regional Operations Section Chief for the Regional Incident Management Team. So a lot of people ask how the Washoe County Health District works into this response. We are one of the 5 branches, so we're the health branch or the public health branch for this response. In that position, we're coordinating all of the vaccine response within the Washoe County region. That includes working extremely closely with the state of Nevada on what the various priority lanes look like, which essential workers fall where, various groups. They provide us lists. We then go back and look at those lists, compare them to business license agencies, regulatory agencies, and try to make sure no one's been missed. We communicate with them all hours of the day or night. Furthermore, we manage all the point of dispensing operations within Washoe County. So whether we're running the point of dispensing, which we use the term pod, or we're ensuring that our regional partners are reporting their numbers up to us so that the public knows where we're at. Next slide. So point of dispensing is something you hear a lot about, which we refer to as a pod. There are 2 large-scale semi-permanent pods inside the Washoe County region. We have the one here at the Reno Sparks Livestock Event Center. Renown has built their own semi-permanent pod that most people have seen down there in the South Truckee Meadows. Furthermore, we have a retail pharmacy vaccination program. Currently, Washoe County has 12 different pharmacies that have signed up, Walgreens and Smith's. As you heard earlier, we have Safeway that's doing a specific group of ineligible group homes and assisted living facilities. We also have community partner strike teams or community partner pods. Currently, right now, Community Health Alliance is one that's done quite a few. Renown's continuing to do public ones. St. Mary's has, and all 4 of our major fire agencies continue to provide pod services. Additionally, we're really proud. Today was the first day this region did homebound seniors. So the Washoe County Health District has put together a team in partnership with REMSA where we actually go to their homes if they meet certain criteria and provide the vaccination. We have REMSA there in case there's any sort of a medical response. We actually do the vaccination there and wait those 15 or 30 minutes. We're planning to do that 2 days a week. We can vaccinate 6 people each day based on travel times and staying at the homes. Next slide. So this is the large Washoe County Health District pod at the RLEC, which is owned and operated by the Reno Sparks Livestock Event Center. So what you're seeing there is a whole bunch of lines. At the north end of that parking lot, if you're familiar with it, is where everyone enters. That first split, which is kind of hard to see because we're showing that we're sharing the screen, is we are actually doing testing and vaccinations at the same time in the morning. So that first split, we have people going either to the vaccination side or the testing side. From there, the lines straight down are the ones getting vaccinated. You'll see 2 parallel lines. That's now 10 based on how we've ramped up. The National Guard is screening all individuals to ensure they're on our rosters and have appointments. All paperwork is checked there. If they don't have paperwork, they go into the southern lanes and they have to refill it out. If they do have paperwork, they go to the northern lanes and they get straight down into those north-south lines you see there. So the lighter north-south lines on the barn side of the property, those are vaccine exclusive lanes. We have 4 of those. We always run those vaccinations now that testing numbers are down. The far east lanes, those 2 are hybrid lanes. Depending on numbers, we either do vaccinations or we do testing. That red lane is the emergency response lane in case we have to bring a fire truck. We have to move up and down our property. This system and setup right now ideally can push through 1,200 vaccinations in 4 hours. The CDC told us to plan for a nurse to do 6 vaccinations an hour. Our design right here has us scheduling at 25 vaccinations and we're averaging about 22. So our staff is very competent. We also have a tremendous number of volunteers. We have the National Guard out there. We have CERT out there that Washoe County's helped providing. Our MRC volunteers are out there. We are continuing to get more and more volunteers. We also have health district staff, and we have, I believe that MRC I did cover with the volunteer things. So that's how we're operating, along with REMSA, that again mans our 15-minute and 30-minute lot. We can go ahead to the next slide. So there are a lot of questions about vaccine allocation and distribution. So the allocation for the state of Nevada is set by the federal government on population. We are still working to completely understand how that is working. The state is working extremely hard. You've seen our governor look into that. You've seen our federal representatives currently looking at that. From there, the state determines the allocation to Nevada counties through population. Right off the top, you've heard about the partnership with the pharmacies. They are getting a percentage of our vaccinations to go ahead and vaccinate the general public, starting with the seniors first. From there, the remaining allocation comes to Washoe County for all the federal approved providers of vaccine. Next slide. So to date, Washoe County, and this slide looks worse than it is, we've actually have given more vaccinations. When we updated this presentation on Monday morning, we actually had just received all the vaccine here. So our doses allocated skyrocketed. They wanted to get here before the storm. We had, as of Monday, administered 31,913 shots. These are state numbers. To actually get that number means all the paperwork, all the data entry is in the system. It's complete. So those are actual doses, whether it's a first dose or a second dose. Excellent. So data entry requirements, you continue to hear about this. You continue to hear about requests for staff for that across the country, needs for that. The health district, because we're a medical provider, has to use our medical records system. That's Patagonia Health. We are using a mass vaccination app. We're actually one of the pilots that's testing it. It seems to be doing extremely well for us when it comes to scheduling. It's also controlling our vaccine inventory. From there, we also have to input into WebIZ so that the state knows those vaccinations are given and anyone else can look up that record within the state. Finally, you see a group called REDCap there. That is a lot of the research and information the CDC is requiring to be collected on these vaccinations. It's a lot of its demographic, age, and also where we are in the essential workforce or where people are employed. Next slide. So some frequently asked questions. We're going to go ahead and start with our website. Scott Oxerart, our regional JIC manager, along with the, of course, Washoe County Health District, public information manager, and our Washoe County TS team have done a tremendous job building this website. They continue to get a lot of kudos for that. So the first thing when you click on that is it's going to ask you if you're 65 or older. So you heard a lot about a wait list or an interest list. So if an individual clicks on that, it's extremely simple. And today has not been the day for internet here at the county complex. We ask that you enter your first and last name, your date of birth so we can confirm age, and then your zip code, email if you have it, and then phone number. So that is the interest list you've heard a lot about. It is over 25,000 individuals strong. This is the list that we pulled from randomly to do the mass vaccinations here last Friday of the over 70 population. Furthermore, we've provided this list to some of our regional partners that have done pods so that they can go ahead and continue to vaccinate whenever possible. And if we go back, so there's some other questions. If we can bring the website up, great. We'll go ahead and show you some other things. There's some key information people can do. So this website has been built where as we get all the essential workforce businesses, we're getting those lists pulled from DETR. We're trying to vet them. We're adding to them. Our website connects to all those lists in the background. You can enter your employer and see if they're on there. If they're not on there, you can notify us and we will get that group on there. You can also look on where we are in the lanes and whether or not you qualify for a vaccination. So that is a really simple process. If you are, then it goes into the steps on how you go about scheduling. If you're not in that lane just yet, then we can go ahead, let's see if we can try this again. You can go ahead and be put on the interest list. So as you can see, we built this website as easy as possible to just give good information. So if you click on lane 1, it covers the frontline essential workforce, and you can click on any one of those boxes and you can start seeing who is in there. Now this is general based on the state guidance, and a lot of times people ask us where they fall in that, and then we go vet that. If we can't answer that question, we coordinate with the state and our other public health authorities within the state to make sure we're all on the same page. So then this is where you can go ahead and search to see if your business is in there. Earlier today, this wasn't working when we did a presentation for the state. So we also built this so that we can sign up for updates as an individual. You can get all the information you need. Furthermore, we're working on a dashboard that's going to be live data. We're going to go ahead and have all our providers enter into a secure website that's going to aggregate all the data so you can see actual shots in arms. We think this will be extremely beneficial both for the public, because right now these are just numbers for Washoe County Health District for what's been vaccinated out at our location. You saw earlier we had 38,000 doses. It's hard to demonstrate right now to the public where everyone else and who else has done vaccine. So that's something we're working extremely hard on. It also will help the health district demonstrate the need for vaccine, demonstrate that we are actually putting it in arms, and that we can utilize all the vaccine we can get. Some other frequently asked questions are, do you still need to wear a mask and socially distance if you've been vaccinated? Yes. Everyone needs to remember these are emergency vaccines. They're still doing research on them. They've been authorized because they're safe, but they're continuing to study them. There are questions on whether or not people can still be a carrier of the SARS-CoV-2 virus even when vaccinated. So these are some of the things and the reasons why we ask that. You also don't know if the people around you have been vaccinated, and it's not something you can ask. Right now, we know most people have not. The other question that's been asked quite a bit is, do you still have to isolate if you've been vaccinated? Yes, you do. So we still require the vaccinations if you're a close contact exposure. Another item I like to try to let people know is these vaccines are 94 to 95% safe. Wearing a regular mask provides protection. If you have an N95 mask, you have the same protection as a vaccine. So I know it's not as comfortable, but when it comes to some of the essential workforces, if they can just remember that they're getting the same protection. I know it's uncomfortable, we've all worn them, and we'd prefer to be vaccinated, so we're doing the best we can. Next slide. So people were asking us if we're gonna shut down. We just threw some pictures in here when we thought we got snow on Monday. As you can see, that's a dusting. This is the operation. That's the north end of the south parking lot. There are about 235 cars in there. All those people got vaccinated in about 35 minutes. So then on the other side, those are the modular testing buildings and vaccination buildings with the modular roof. We have designed everything to be picked up and moved off this site if there's another regional location we have to set up on. Furthermore, we took all the lessons learned while testing to design these buildings the best we can go. Next slide. So this was this morning at 6 a.m. And I got to give a lot of credit to our LEC staff, National Guard staff, and actually some of our incident management team that wear a multitude of hats because we really have a very small group of individuals that are running this operation. So we have brought in all the equipment. We have used our state CARES money to the best of our ability to ensure that we're ready to rock and roll when we set a pod. The last thing we want to do is the public clamors for a vaccination is to finally schedule them and then have to call them and cancel. Furthermore, I'm trying to balance first shot, second shots, Moderna, Pfizer, and also expiration dates. Once the Pfizer comes out of the freezer, I've got 5 days to get it in people's arms. So that was this morning at 6 a.m. demonstrating that we can be up and operational. We have teams set up just for snow removal. So then we just want to take the opportunity to show the region what the org charts look like. This is the regional incident management team. These are the branches that are out there. The health branch drops below. You see those operations right there. But we have an enforcement branch for COVID-19. We have a REMSA EMS first responder branch, and we have a health and human services branch. Furthermore, there is a recovery branch. I realized this morning I need to get on this chart. Next slide. So then we have, everyone sees the pod out there for either vaccinations or our post for testing. That is the public-facing operation for the health district. But really, there's an entire team inside this building constantly managing, planning, and doing all the grunt work for paperwork, finances, scheduling, and logistics. So that is just for our pod operation to run the outside operation. And these are groups. These aren't actual individuals. Next slide. So then this is the actual pod operation. Those wiggly lines show the flow through the actual pod when you get a vaccination all the way to our 15 to 30 minute lot. Next slide. Then we went ahead and threw in the testing operation because that is completely different. It looks very simple right there, but it is not. And we continue to operate in this manner. Furthermore, we still have the National Guard. They are out there now approved to vaccinate, and today FEMA did approve the resource so quickly that actually we got 10 vaccinators today. We have some data entry people and some logistics people we're working in the operation. So with that, I believe we can open it up to any questions, and I think it would probably be easier if you could address them to either myself or Lisa, depending on who you'd like to answer.
Got it. Thank you, Mr. English, Ms. Lawrence. Councilman Dare, I know this is the item that you asked for. I'll go and let you kick it off.
I just want to say thank you. That was actually an incredible presentation. I think it gives us the pictures of what's happening. One of my biggest goals was to try to make sure our community, anybody wanting to see this, understood kind of what was happening, some of the differences, and how this is working. So these kind of updates are fantastic, and I appreciate them. And so as we continue to go, but we are very aware of just how strong and our community is working together under your leadership. We've been listening to some of your other things that you guys put out. So thank you. And I don't have a lot of questions. I just want to thank you for this kind of presentation. I think we're the experts in the room on this and what's happening, and sometimes the information doesn't get out there as well as it could. So this kind of thing really helps. Thank you.
Thank you, Councilman, for asking for the presentation. Any other comments from the board?
Terrific job, guys.
Great job. I have a question or two. And Mr. Young, go for it.
No, I just have a question in terms of this it's a colossal and it's going to continue to be a major endeavor to, get people lined up and shots in arms. And I think that the challenge for the health department in marketing is going to be even greater when, we get towards the later part of this thing there too, to get people to actually, continue to want to get vaccinated, which I think is going to be incredibly important. But are we getting in this community an average number of resistance to getting from all phases of people who refuse to get vaccinated for whatever reason or something? Or are we getting right now I saw a good response, but I was kind of concerned that we have some folks that might not want to get vaccinated, which is scary to me.
I guess Jim English for the record, I guess I'll go ahead and answer that to the best of my ability, and Lisa can come in with any medical background. The anecdotal information we're getting is it's probably based on either your profession and how you've been affected by COVID right now, or how it's affected people you know. And it also probably depends on what you foresee as being an essential worker or or what it takes to would be the best way. Whether or not it's best time for you to do that. What we have seen has been extremely difficult for us in scheduling is we thought we got through tier 1 as a community here in Washoe County. We have found is there's a large number of employees at these tier 1 businesses that decided not to get the vaccination, then saw that their coworkers were fine. You are going to get side effects, that is known, but now they want the vaccination. So we're continuing to add people to those lists. We have also seen anecdotally, it's very interesting, our police agencies, because depending on who they're involved with, they have done some polling because no one can actually ask if you've been vaccinated or not. But it seems like swing and graveyard shifts tend to want the vaccine a lot faster and need it, probably because of the work they're doing and the fact that they're engaging more with the public sometimes. That's why these tiers were set up this way. I go back to the whole theory of when we have to determine who, and the state had to work on this, who was going to be those that needed to be vaccinated first. It was whether or not you could properly put on PPE. So, and whether or not you can put it on a timely manner before you had to respond. So our frontline law enforcement, EMS, and medical workers are the ones that have to run in and deal with a citizen really quickly. That's why they were first up. Everyone else, now that PPE is available, can go ahead and don an N95 and be protected at some level until such time. But we are seeing a high need and want for this vaccine. People are not shying away from it. You heard a lot of people saying they weren't going to get it. We heard it here at the health district. Oh, I'm not going to get it. It's emergency use. Everyone that we have offered it up to has pretty much accepted it. I would say this community right now has about an 85 to 90% of the citizens we have offered the vaccine to have accepted it. So we saw it last week when it was snowing and windy and freezing. The seniors came out on their cars, their bicycles, the RTC buses. People want this vaccine. We're going to do the best we can to get it in arms, and we have not seen people push back and say this is not a vaccine to get or have turned down appointment offers.
Well, that's great, and this certainly is a huge logistical challenge, and I'm very, very proud and happy, and I think speaking for the rest of the board that you are running this operation and doing this, and making us all proud, and let's get vaccines in arms. So good job, and thank you very much.
Any other comments from the board?
Chair, I just have one more.
Yeah, Councilman.
Can you just put on the record, I know the answer, but I want to be able to continue. A lot of us are working hard to try to get more vaccine in our community into Nevada. And so we are ready and able to do more vaccines than we have, correct? Again, I think I know the answer, but I just wanted you to say it out loud on here that the reason we don't have them is not because we are not ready. It is because we do not have the vaccines.
That is absolutely correct. So about 3 weeks ago, we were able to get around 6,600 doses of vaccine. When I say that, I'm talking first doses. That was before those private pharmacies came online to begin administering vaccine. We were fully expecting to continue to get at least that 6,600 initial first doses, plus additional vaccine for those private pharmacies to assist in our senior populations. What instead happened was their allotment came off the top from Washoe County Regional allotment. So we went from 6,600 to about 4,600 in the course of a week. We have been told to plan for the next 3 weeks to be at 4,400. The health district and with the regional partners have worked extremely hard to try to have some equity in who gets the vaccine between essential workers and the general population. I've been seeing our reports daily. I sign off on every one of them. I see where the deaths are. I also know where the cases are, and we have that balancing act. So right now what we've attempted to do is we're attempting to split somewhere between 40-60% between the general public and the essential workforce. Everyone can make an argument one way or the other, but that is the decision, and that's some of the hard decisions that both Lisa and I have to do. So we also realize the amount of effort Renown put into building their operation, and we want to keep that running. So since they have offered to vaccinate anyone through their MyChart system, we have tried to keep them in operation. So with our last 4,400 doses, the health district kept 2,400 for essential workers and 2,000 went to Renown. Another 1,800 went on to those private pharmacists that are actually getting those in arms this week. What we did do was we got some really good news about 48 hours ago that there was truth in the fact that there would be an extra 15 to 16% additional allocation. So this upcoming week, we are getting another 500 doses that originally we were told not to plan for. Those additional 500 doses have actually allowed us to open up an additional essential workforce pod here next week that was not planned, and also to give some of our community partners vaccines so they can continue operating into next week. So that is the balancing act we're going forward with. The pharmacists will continue to get approximately 1,800 off the top. We don't have any say in that. If they don't utilize it, I can potentially get it back into our hands. So at the current time right now, the health district is getting all the vaccine we can, and we are working with all our regional partners to continue to deploy it where it makes the most sense. I can tell you that the orders well far exceed what our allotment is. I mean, yesterday alone, we had to make the difficult decision to actually contact about 9 different providers and let them know that all the vaccine they ordered may not come or it's being reduced, because we're getting requests of about 12 to 18,000 first doses a week. Whereas you heard we're at 4,900. So it's a really tough decision. We're going to continue to ask for as much vaccine as possible. Our operation right now most efficiently runs at 1,200 shots every 4 hours. The state emergency management team would like us to be able to do 2,400 as a region. We can easily do that in one day, just between Renown and ourselves. You do have to factor in, we do have to get second doses. There is a lot of information and questions about second doses. We have been getting all the second doses for all the first doses we've received. One thing that may come out in the media, or if anyone listened to the statewide task force today, I did not know this, but the state is having Moderna and Pfizer store our second doses so that we don't have to deal with the shipping and handling. So it sounds like we're controlling the vaccine. We're not. We're utilizing it as best as we can. It actually puts an additional onus on Lisa's team, because we then have to do the distribution and the electronic transfers of that vaccine. But we definitely can ramp up here. Our regional partners are all set up. They're basically waiting for the green light. Renown is operating at full capacity based on the vaccine they get. And I'm sure anyone else that we continue to hear daily that they're ready to go. We know we're ready to go. Now we have the volunteers, we have the infrastructure. We just need that one little piece.
Good job. I thought that was the answer. Appreciate it.
Thank you, Mr. English. Any other questions from the board? I have a general question. Lisa, probably for you. The chart on the PowerPoint, you had the lanes.
Yes.
One for essential workers, the other general public. When will the general public know when we've advanced? How do you guys receive that information to know we can start moving down?
Right, so that's a great question. So our website, one thing that we didn't get to, you can sign up for daily updates on that. And as for right now, as for seniors, we have 25,000 seniors that have signed up for our wait list. And we are pulling from that whenever we're having a pod or when someone else in the community needs names for a 70-plus pod, we can give those to them. So then they are contacted to schedule an appointment. But we encourage people to sign up for the daily updates. And then our public information officer is doing updates every day on where we're at in the lanes. And as on that one screen you saw where it's bolded as to where we're at in the essential workforce. And it lets you know. And then I didn't click on the other side, but on lane 1 also it lets you know where we are, which is at 70 plus for the general population.
Thank you. And one more that I've received a lot of questions on is, we started taking demographical information with the tests when people came out positive, COVID positive, and they saw the ethnic relations and saw some of the communities that are disproportionately being impacted. Are we seeing that correlate with the vaccine as well?
As far as
are we seeing a correlation with those that are being impacted, those communities that are disproportionately being impacted, ethnic groups? Are we seeing that there's an opportunity for those groups to get the vaccine, or are they working one-on-one? I know it's through the state, but the community is asking quite a bit because that chart gets quite a bit of questions in the media.
So ensuring vaccine equity, is that, yes, so as far as when we were talking about Renown and the My Chart, and for us, anyone that is distributing vaccine right now needs to be able to distribute that vaccine to anyone in our community, not just because they're a patient and have insurance. Anyone is eligible. Plus, one of our great partners, Community Health Alliance, is providing a pod on a weekly basis, and they're providing vaccine as well. But no, that is a big part of our mission, is to ensure vaccine equity and that it's distributed equally to everyone in our community.
So are we collecting that as the vaccine, ethnic makeups and everything else, and are we updating that as well, tracking that on our system?
Yes, the red cap system, that is one thing that is asked. For everyone that gets a first or second dose, it does ask race and ethnicity.
Okay, thank you. Any other additional questions? Seeing none, thank you to both of you for your teams, your hard work. I know it's a lot of stress. I appreciate it. Please give my thanks to them as well. Thank you again, Councilman Dare, for asking for the presentation. District Health Officer, item number 15.
Yes, thank you, Chair Delgado. The next item is discussion and possible. Apologize, didn't have my mic on. Item 15 is discussion and possible direction to staff regarding the January 20th, 2021 concurrent meeting with the City of Sparks, City of Reno, and Washoe County. And I think we'd like to begin with just a recap of the meeting from the participants that we have on the board.
Yeah, we'll just go off of the lineup here. Councilman Dare, if you'd like to speak on behalf of the City of Sparks and regarding our concurrent meeting.
I sure can. We pulled together, we've been having concurrent meetings, which is, I think, fantastic, just to talk as a region about things that we see are necessary and needed. And we actually called this one together a little bit regarding what was going on. And there's a couple of things that were concerns. I'll share from my point, and one of our mayors definitely is some of the conversation regarding the ability to have an appeals process. And that's something that he's very concerned about, and I can see where a lot of things don't come back to us necessarily. And so where do they go? We know that there is an appeals process in place. It's not that it's absent necessarily, but is it what we are looking for? Is there something more we can do? And that was part of the conversation. A big part of the conversation came to the idea is, do we have the right constructs of the board? And that's a conversation a little bit. Some of the one that I brought to the table. And I know that that might sound strange to some of our board members, and this is not a shot at any of us. My biggest concern has been, and this has not been new to anybody, I think, here, but definitely not to Kevin Dick or to John Novak. We've been talking about this. For me, when it comes to what we do as a board, I believe one of our biggest jobs is to hire somebody that we actually cover like an umbrella. And I actually am going to give us a picture of what so I'm going to give you a picture to get in your mind. There you go. I even have an umbrella. There you go. See my umbrella? So our job as a board is to cover the decisions made. And so for me, that's what we do with the budget. You know, as long as it's in the budget, they can make decisions with that. But if they're going to go outside the budget, then we know they just got to come back and make sure the budget's approved. If they're making decisions that seem to fall outside of this. Now, in the past, we've only had a few things. With COVID hitting, part of it is there's a lot of moving things, a lot of moving parts. And I'll even say that I'm sure it's very difficult to figure out how to always stay under this umbrella that you see me using right here. But it has to happen. It has to be a part of the process. And part of my concern is, do we have the right constructs to make sure this stays in that place? Because the last thing I ever want to see is, you know, I'm part of the one that stands with Kevin Dick. I help continue to renew his contract and believe in him and all those things, but I don't want to find himself have to be outside of the umbrella of our covering. And so I have a lot of questions in making sure, do we have the right structure in place? Some of those questions came up is, do we need to add more political on here, more different, maybe 2 from each place. We do that with some other boards, and then still have our professionals. Because that's one thing for me, I would never, for me, want to see our professionals leave the table. I think what is brought to the table by their wisdom and what they've seen is crucial. So that's not really something I'm looking for, but it just was part of the conversation. In the end, as far as Sparks goes, the only thing that happened in that meeting is that we asked our staff to go look at some possible things. What do they do in the South? What are some different areas? So those are still ongoing conversations. But I would say to our board, and just want to let you guys know the heart that I have, is I totally, truly watch and respect things we've gone through. And I do realize, and even reminded recently, just of the unprecedented times we're in. And I want to respect that. I really do, that we're dealing with stuff that, we have never dealt with as a health district before. And so there's going to be mistakes made sometimes and things. But I do want to make sure we do our best to cover who we have, our staff. They should never walk out and make decisions, send letters, do things that afterwards aren't covered by us. Our names are on that, and I want to make sure that's fact. So those are things I was concerned about, things we brought up. Everyone kind of had different things, but from Sparks, our final conversation came back to say, our staff at Sparks, go look at some ideas, come back, and then we are going to have another meeting to talk about this. But at this next meeting, we want to bring us to the table. The health board is going to be there, and we're going to be there to help explain and help us say what we do, because this is not trying to be done in some box over here, like, all of a sudden, oh no, what are they up to? We really want to see in the very end, have the best practice put together for our region to cover all of our staff, but also to have the best outcomes and balances. So I hope you understand that. I know that it's always weird when you get us all together talking about someone's job or a board, but we're not trying to cause confusion. We're trying to help. And the last thing I would say is I did get some flack from some people saying, why would we even talk about this in the midst of a COVID pandemic? Why don't you just leave things alone? Well, I'd say this, if it was a 3-month emergency, then that is very much, you would just let people get through the emergency. This has been going on for 11 months, and we don't know how long this is going to last. And so to sit back, this is my opinion, you don't have to agree with me, but to sit back and say, well, we'll just wait till it's done. I don't think that way, because I think in the middle of this, we still need to cover our workers. Our job doesn't change as a board, and I want to make sure that we do our best. So those are the things that I'm thinking, and I just wanted you to know, as far as Sparks goes, that's our next steps and our next concurrent meeting. Hopefully you'll see that you guys are all part of that conversation, and I'm excited to have the conversation in a good, healthy way for our region. Thanks.
Thank you, Councilman. Appreciate your comments, your opinions. Commissioner Lucy, would you like to give us a summary from the Washoe County Commission?
Chair, I don't see Commissioner logged in, so I'm not really sure if he's logged in as a different,
Okay.
with a phone number or something, but.
He's on his phone because his other thing wasn't working, but I'll text him and see what he's doing.
So when he gets back on, we'll come back to Commissioner Lucy. I'll speak on behalf of the city of Reno. I thought it was a good meeting. I know it was a meeting that was, for some time, we've been trying to put together for some time to at least get everybody on the same page in terms of just concerns or general comments about the health district. I thought it was a good meeting to have. It was an opportunity for people to shed ideas and also concerns. From what I received and what the city of Reno will move forward with are, we'll meet again and we'll have a further discussion and details as to what those concerns are and also what ideas we can bring to the table. Some of the things that were highlighted were opportunities to better communicate, not only to the community regarding COVID and vaccines, but opportunities for other sectors to be included in conversations such as business, health, gaming, et cetera. So we'll be looking at possibly working with the district health officer with respect to maybe advisory committees or other opportunities for people to make sure that they're being heard, developers, builders as well. To Councilman Dare's comments, business is still going forward. People are still conducting business. People are still going to work, but making sure that people understand what those roles are as they're changing constantly. And a good way of curbing some of those concerns is by having communication and accessibility. So that's what the city of Reno concluded with respect to the board makeup. I think that's still a conversation we're having at the city of Reno as to whether there's a benefit or not. Me personally, I don't necessarily see a huge benefit of adding more electeds, but I'm always open to the conversation and debate as to if we're making things better, then let's do that. We have some other boards across our county that are a mix of electeds and a mix of professionals in our communities, and they do a great job. If the conversation is all boards should be made up by electeds, then I think that opens up the conversation to look at all of our regional boards and have that same discussion. So it's, again, a debatable conversation, but ultimately at the end of the day, I think it's an opportunity for us to have those conversations within our own jurisdictions, come back to see if there's an opportunity to further advance, again, our mission at the health district to enhance the quality of life. So we'll come back to those and we'll bring those to the concurrent meeting and see if there's buy-in from all three jurisdictions to have that open conversation. That's the city of Reno, wrapping up on that piece. I'll be looking for Commissioner Lucy if he's available to add comments, if he's jumped back on or not.
I don't see him. I don't know. I don't know if it's still snowing at his house, maybe. I don't know.
Maybe. Hope he's doing all right. I'm sure he is. I'll open it up to the rest of the board. If you have any questions with respect to our quick summaries from both Councilman Dare and myself. Seeing none, so what we can do in terms of action items or opportunities is District Health Officer and to our board, City of Reno will conduct our own meeting. We'll, of course, submit those comments to our board here and to the concurrent meeting. And we'll have conversations here. Hopefully, it won't linger too long in the next two or 3 months, as long as people can get together to have some of these. But it doesn't mean we can't move forward. District Health Officer have spoken to our Vice Chair. We would like to set up meetings sooner than later to start talking about some of these high points and I think some low-hanging fruit opportunities to get the dialogue going. Councilman Dare.
Yeah, just real quick. I think one suggestion that we could potentially do with this is let us make sure we understand our appeals process really well. Because that's one thing that, I've been on the board now for 5 years, and and in truth, when people ask me, I had to stop and say, well, truthfully, I don't know that I understand it as well as I need to. And I can't, maybe I'm the only one on the board, but I think it'd be great to look into it, because maybe it doesn't need to be fixed. Maybe it just needs communication, or maybe there are ways to make it clearer. I don't know, and I want to be careful that I don't shoot at what I don't understand. And so with that, that could be some of the homework we do. But I would also open up to our board, and please, if you didn't get to watch the concurrent meeting, I'd encourage you to, I think it's public for anybody to see. If you have any questions, please reach out. We want to make sure you understand this is not, I hope it's not taken like that to anybody to give any slight to what we've done in the past. We just always are looking at making sure how we can run the best we can, and how do we do that and make sure we cover our region. Because part of what our job is, and this is my opinion at least, there's a lot that happens in our community, whether it's COVID or something else, and things come to us from our state, from our governor, from whatever. Our job is to process that. How does this apply to us? And we are here as elected officials, but also as people who have volunteered officials to step up to say we're that barrier, we're that buffer of these things. So how do we work together to make sure we're processing what's coming from the state and the governor, and then we get to process that through. And that's how we function. We live in America, and we get to represent in that way. And so I want to make sure we're doing that to the best of our ability. But we want you involved in this process. I do. I know Oscar, Chair Oscar Delgado does, and I know Bob Lucy does as well. So please just know that if there's questions, even if there's a one-on-one conversation, I'm open to that myself. Thank you.
Thank you again, Councilman Dare, appreciate it. Looking for any more comments? Seeing none, thank you. We'll close up item number 15. We'll move on to item 16, presentation discussion from Ms. Gutman-Dodson on the Washoe County Health District's 2021 legislative principles and priorities.
Hi, everyone. Thank you. This is Joelle Gutman-Dodson. And I think you all have this in front of you. It's item number 16. So we're going into our 81st legislative session on Monday. I can't believe it's already happening, but it is. I am not a registered lobbyist yet. The rules have not been changed from the legislature to allow for virtual lobbying. That's anticipated to happen the first day of session. So I'm still the government affairs liaison as of today. But I just wanted to walk you through our, and get your approval for our 2021 legislative principles and priorities. I left it more vague this session, starting this session, because a lot of the bill language isn't yet available, and we have to adapt to the times. We don't know what this session's going to look like yet. We don't know how many bills are going to be processed, and we don't know, we just don't know. So I've left our priorities more as priorities rather than specific bills. And when those specific bills do come up, I will report back to you on a monthly basis at the monthly DBOH meeting. So I'll just go into our principles quickly and then go to our priorities. We kept our principles mostly the same as last year. Just adding in the lessons we've learned from this time and this period in our lives. Public health has been at the epicenter of this pandemic from day one. And we learned, as a health district, we have transformed overnight multiple times to address this pandemic. And we're gonna take those lessons and hopefully utilize them and advocate and educate to our state legislators with our lessons learned. So our first one is partners providing service to our shared constituents. And as you all know, this year required a cooperative and integrated approach. And that's gonna be the same with legislative relations. This year, like none other, all of our government bodies have out of necessity had to put differences of priority behind and focus on the safety of our citizens. 2020 proved and hopefully sets precedents for a continued shared mutual interest in the public health and safety of all Nevadans. So we really came together as a community and utilized resources, and I hope that lesson moves forward. We want to continue to prevent, promote, and protect, especially our finances and our staff at the health district. So our financial model must align with the needs of the community, and public health monies must be protected and preserved. We've learned that the entire public health infrastructure can be shifted overnight with emergencies large and small, but our staffing levels, funding levels, and resources must remain ample, able, and ready. They also must remain flexible, so we're able to have some discretion in how our decision-making processes are made, so we can achieve optimal outcomes quickly. That goes into local flexibility. We need to be able to make decisions locally. As we know, all of us know, we're very different from other jurisdictions in this state, and decisions and outcomes have reflected that. So we want to maintain our local flexibility. We really want to be cognizant of any unfunded mandates, and we strongly oppose them. We cannot have more put on us without proper funding. So that's very important to the health district. And then I'll move on into our priorities that we have right now, and those are open to change, but a lot of them align with our CHIP initiative, our Community Health Improvement Initiative. So we're continuing our efforts with affordable housing and homelessness. We will be advocating for state policy to mandate notice of affected residents and local jurisdictions when subsidized affordable housing is at risk. We will support legislation targeted at improving affordable housing preservation. And that's for our behavior, that's for affordable housing. And then we'll continue with behavioral health, which is also in our CHIP. And this is the Washoe County Behavioral Health Policy Board's bill, BDR bill, that they have put forth this session. So we'll be supporting legislation targeted at best practice and utilization of peer recovery support specialists, or PRSS workers. We'll support legislation targeted at improving access to data about our providers, so we have a better idea of who is doing what in our communities and what the need is. We'll support legislation targeted at improving access to claims data, utilization, and access to care. We'll support legislation to revise policies that would allow for expedited licensure of mental health professionals, so we can have more mental health professionals, behavioral health professionals helping, especially in a time like this. For our air quality department, this is something we've been looking at for several years, and we're hoping this session could be the year, is to close that classic vehicle loophole by supporting legislation on getting rid of the high polluting vehicles that are clearly not classic vehicles. So we're working with Assemblyman Howard Watts on that. For our communicable diseases priorities, we're supporting legislation that modernizes and decriminalizes HIV in our Nevada revised statute. And for Tobacco 21 priorities, we are supporting Tobacco 21, which would prohibit a person from selling, distributing, or offering to sell tobacco products to a person under 21. It revises provisions governing the inspection of locations that sell tobacco products, revises penalties for selling to a minor, and revises definitions relating to the regulation and taxation of tobacco products. So that's what we have walking into Monday. As we all know, things change often and quickly, and I will do my best to keep the board abreast of the situations going on. If anybody has any questions or things they'd like to add, please let me know.
Questions from the board? Councilman Dare.
I have one question regarding on our smog. I know that there's been talk in the past about that might change where we don't have smogs as much because of cars and potential shifting of that, but we get actually some revenue out of that. Is there anything we're trying to do to help protect that revenue stream?
Yes, so that is a little bit separate from the classic vehicle bill, the loophole bill, but that is something we discussed last session, and potentially this could happen this session, is instead of having the fee tied to smog, it could be a fee tied to your registration. So it could be more of an upfront fee so that we wouldn't lose that revenue. That's going to be a battle with smog providers, obviously. If we reduce the you know, how you have to get a smog every 2 years, no matter how old your car is. If we revise that, that would definitely impact that industry. So that's something we've looked at. It's just, I'm not sure where that's going to fit in this session, because if we don't fix the revenue, that we don't really want to decrease revenue right now.
I say my concern is if we're not trying to be in front of the conversation, we might find ourselves in the middle of a time, because we don't meet but every 2 years. So we might find ourselves at a place where we're at a loss for a while. So we either need to prepare for that, or we might need to go and kick that can a little farther down the road, is my thought.
Thank you. We have tried to stay in tune to that conversation. I haven't heard anything come up this year or seen anything in any language, but if it does, I will let you know. And that is a conversation we have with legislators who are interested in that topic. Thank you.
Look into the board. Any other questions? Seeing none, thank you, Ms. Gutman-Dotson, for your presentation. Good luck on Friday. Appreciate your updates as you see them brought to the board. Yes.
Can we get the board to approve the policies and the priorities?
Yep.
Sorry, I think I left my mic. If we could have the board approve the policies and priorities, that would then give us this as the umbrella to operate under for the legislative.
So can I get a motion to support the principles and priorities for Ms. Dotson move? Got a motion? And a second. Any discussion? All those in favor say aye. All opposed? Motion carries. Again, thank you. Good luck.
Thank you.
All right, moving on to item 17, staff reports and program updates. Up on base, Mr. Vega, Air Quality Management.
I think it's going to be Dan Inouye.
Oh.
Good afternoon, Mr. Chair and members of the board. For the record, Daniel Inouye with Air Quality Management. I do not have any additional updates to the director's report, but I'm available for any questions.
Any questions from the board? Seeing none, thank you, sir, for your report.
Thank you.
B, Community and Clinical Health Services. Lisa, come on down, thank you.
Hi, Lisa Latritz, Community and Clinical Health Services Division Director. I do not have anything to add to my report, but happy to answer any questions you might have.
Any questions for Lisa, looking at the board? Seeing none, thank you very much. Appreciate your report, thank you. Item C, Environmental Health Services. Mr. Kevin Dick.
Yeah, I just wanted to make a comment before I turn it over to Dave Kelly and Aaron Dixon, if there are any questions. But in regard to SB4, I received a nice note yesterday from the chair of the Gaming Control Board that I wanted to read to the board. It says, "Great thanks to you and your staff for your robust efforts to enforce the regulatory provisions of SB4. You all have done outstanding work that is a model for my colleagues in other parts of the state. My father, as vice chair of the Clark County Commission, has heard me compare his agency's efforts regarding SB4 compared to the small but mighty Washoe County Health District and your hard work more times than he wishes to recall, I'm sure. All the best, Bryn Gibson." So I thought that was very, very nice of him to send that our way.
That is awesome. Thank you. I appreciate any sentiments and conversations from any of the, especially the Gaming Control Board. They're very influential, and that means a lot. That's big leverage. So thank you to the team for that. Mr. Dave Kelly, are you ready for your report?
Good afternoon, board. This is Erin Dixon. I'll be presenting the report to you this afternoon. I don't have anything to add, but I am available for questions.
Any questions for Ms. Gibson from the board? Seeing none, thank you so much, Ms. Gibson, and Mr. Kelly for your report. Item D, Epidemiology and Public Health. Andrea, is she prepared?
Hi, this is Andrea Esp, Acting Division Director of Epidemiology and Public Health Preparedness. Thank you for having me, Chair and members of the board. Before you, you have my report. I have nothing to add, but I'm available to answer any questions that you may have.
Any questions from Jerry from the board?
I have one.
Yes, Councilman Dare.
Yes. Hi, and congratulations again on your baby. She's making her debut. Perfect. My question has to do with the flu and things of that fashion and what we think we expect as we roll out. I mean, obviously, it's been a problem in the past. COVID is getting most of our attention, but we know that the flu did not go away.
That is a great question. I know we recently had our a recent flu death, but will follow up with you. I will touch base with Heather Kerwin, our senior epidemiologist and program manager of epidemiology, and make sure that we get a thorough report back to you on what we expect to see moving forward with flu.
Thank you.
Thank you for the question, Councilman. Thank you for the report. District Health Officer, item E.
Yes, thank you, Mr. Chair. Just wanted to follow up on the presentation that you heard on the vaccinations and just acknowledge the incredibly hard work that Ms. Latris and Mr. English have done on top of all of our other response to COVID-19, standing up the vaccination effort. I'm not sure if they even leave the health district anymore. They've been working so hard on this. So I wanted to acknowledge that and also let the board know that I did receive a text from Scott Oxerer, our communications manager, and the non-functioning piece of that website presentation as far as putting in your employer and finding out where you're at. Scott informs me that it's because our web browser is not up to date, but that is functional on the website if people have a current version of the browser. So that's just an explanation for everybody. And then I just briefly wanted to comment on the Community Health Improvement Plan. The kickoff event occurred virtually this morning and was quite well attended with over 100 people that had participated on that. And I wanted to thank and acknowledge also our former Chair, Dr. Novak, who made some opening remarks, and each of our elected members on the board also presented and talked about the homelessness work that's going on. So just wanted to highlight that and be happy to take any questions.
Thank you. District Health Officer, any questions for Mr. Dick from the board? Seeing none, we'll close out item E. Moving on to item 18, board comments. Any comments from the board?
Good luck, Mr. Chair.
Good luck. I'll take all the luck. I'll take all the support too, Dr. No, I appreciate that. Thank you. Anybody out there on Zoom, any questions, any comments? Seeing none, we'll close out item 18, board comments. Public comment. Any public comment?
We do not have any, Chair.
Can I take a motion to adjourn, please?
So moved.
Motion second. Can I get a yay?
Second.
Yay.
Yay. Thanks, you guys. Be safe. See you later. Good job.
Thank you.